Hi, my name is Dr. Celine Higton. I'm a general dentist working in London with a special interest in cosmetic restorative dentistry. I'm a keen advocate for biomimetic and adhesive approaches to dentistry and a self-professed rubber dam zealot. Today, I'm going to be talking about patient acceptance of your treatment options. Now, this isn't necessarily a clinical tip, but it's an important tip nonetheless, especially when it comes to the use of rubber dam. Many people tell me that their patients will not accept rubber dam and that they cannot tolerate it, they hate it, and they just won't take it. Now, the main reason for this, really, in my opinion, is these patients are surprised with the rubber dam. Now, imagine you are a patient, especially a patient in your 50s, 60s, who's been having dentistry done a certain way your whole life. You arrive for the filling, which you're not looking forward to. You have your filling, an amalgam, and it takes about 15 minutes. And this is your idea of dentistry. So what I'm going to discuss now essentially is presenting to your patient how you do dentistry. So when I see my patients, I see them for initial consultation. We do the treatment planning stage. We go through the treatment options and we settle on a treatment plan, either in one or two separate appointments, depending on how complex the case. Now, when we're going through the treatment plan, this is when I present to the patient how I work. I don't present it as optional. I just present it as the status quo. So I will discuss biomimetic approaches. I will discuss the nature of how I work and why. I will discuss the use of composite, onlays versus crowns, again, why. And I will, of course, discuss the use of rubber dam. So my patient who's used to having their fillings done in 15 minutes is now prepared for the fact that actually these two fillings are going to probably take an hour and a half. They're going to be done under rubber dam, and this is why. So I will show them the rubber dam. I will explain all the benefits. I'll explain not just the benefits to the patient, but the benefits for the material choice, the benefits for the dental team. And generally just the fact that the use of rubber dam facilitates better dentistry. So the patient is prepared for this different way of doing dentistry. So when they arrive for their appointment with me, they are not thinking this is going to take 15 minutes. They're thinking, oh, this is going to take a bit longer than I'm used to, but it's going to be this kind of new, different way of doing things. The gold standard way, it seems special, it seems different. And all of my patients are actually quite excited by the time they come for their appointment. I've not had a single patient reject rubber dam in over a year. And I genuinely believe this is because I present it as non-optional and I present it to them before the actual treatment day. Patients do not like surprises. I don't like surprises. If I went to the dentist and I'd never seen a rubber dam before and suddenly the dentist is trying to attach this rubber sheet in my mouth, I would probably reject it as well. So my tip today really is just to say, present all of your treatment options and your treatment techniques before the actual treatment stage. Do not surprise your patients with longer treatments or different treatment techniques that they're not used to on the day of treatment, because patients are already nervous, they are already scared, they are already anxious, so they are much more likely to reject something they're not expecting. No surprises, discuss it all before the day and your patients will happily accept it.